Good afternoon, Dr. Garrett here. Dr. Gary on the road. We sell dental practices nationwide. Today's topic is an important characteristic when selling a dental practice that buyers and banks often neglect and undervalue. We'll talk about that today. So we've been in business now 13 years. I was a dentist for 25. And we're now in 28 states, and we have 10 employees. We just returned from North Carolina and Texas and picked up a few great practices. In addition, we're now available to you from 8 a.m. till 9 p.m. East Coast time. So give us a call. We pick up every day except Christmas and Easter. The phone is picked up. So between myself and our 10 employees, we're able to give you great service. So certainly please give us a ring. Now, the information you're about to hear is for entertainment purposes. It's not legal or business advice. Our phone number is 201-663-0935, and our website is nationwidedentalpracticebroker.com or dentalpracticeguide.com. Either way, give us a ring and be happy to service you and answer any questions you have. Also, if you're thinking about selling to a DSO, please give us a call because we work with them on the opposite side of the table all the time, and we know what they're looking for. We understand how they change from year to year, what their valuations are. We know a lot about them. And we could pick and choose because we don't work for them, but pick and choose who the best ones for you are. But also, they will often pay our legal fees, so the seller does not have they will pay our commission, and so the seller doesn't have a commission to pay. And at times, and we've done this often, we can have your legal fees reimbursed upon successful closing. So that's been working out real nice for the doctors, for those sellers. So give us a call on that, 201-663-0935. Now, today's topic, what characteristic of a dental office that I'm noticing that is totally undervalued and by both DSOs and banks and private doctors, buyers. It's often neglected, undervalued, and it's something that has tremendous value to it, but it's more of an intangible one. And that is the that is the tone of the office, the atmosphere of the office, the personality of the staff, and how over the years the office has sort of recruited a certain type of patient that fits that mold. It's a friendly, kind, homogeneous, long-term staff, great doctor, great personality, and this is sometimes neglected. It's not valued. There is no value on a term sheet. It's intangible, but it's something that should be analyzed. And I'll give you an example. This one doctor I saw the other day, right now we're in February, March 2023, and everybody's having a really hard time getting hygienists. It's like impossible. And some places around the country, like Fairfax County, are paying up to $57 to $60 an hour. It's pretty high. And some of them cannot find hygienists. Whereas I just left an office in a small town, and they one of the only dentists in the town, but the office staff is just remarkable, friendly, kind, dedicated, long-term. He told me he has 2 hygienists. He has a staff of 3. She, a staff of 3 hygienists. That 2 hygienists that are not working there now but used to work are dying to come back and work there. So that personality of that doctor, how he treats the staff, and consequently the type of staff he has, is strong enough that he has 2 hygienists that want to come back and work in this marketplace. They want to work specifically for him or her. That is something very special. Very, very special. These things get neglected. It doesn't come on a sheet that evaluates an office. It doesn't have any spot on the profit and loss. And it's something I think that people neglect too often. Because don't forget, it's probably a certain type of patient also that this brings on. And it will make your life easier. There's an area of the country that has the highest lawsuits, personal lawsuits, business lawsuits in the country. Now, I don't know if you want to be in there as a dentist in that town. Okay? I just don't think you want to be there. And this office is not one of those. It's an office that everybody gets along, fantastic staff, a harmony among the staff, a very, good karma, if you want to call it. There's so many positive characteristics of this office. But that feeling, that intangible, is often neglected, doesn't have a financial value to it, but it should. For you, it may make your life a lot easier. And you could be significantly, have a much more comfortable life and have a happy staff and patients that are pre-screened. The office just attracts a certain type of patient, attracts a certain type of employee, and this is a great staff. I could tell when I walked in this office, the general atmosphere. I could just tell right away. The atmosphere in that office is one that made me feel most comfortable. And I knew anybody that goes in there is going to feel comfortable. So I ask you as buyers, whether it's a DSO or whether you're a private buyer, to put some value on this, because it's often neglected on that harmony of an office, the tone of an office, the type of employer the doctor is, that he retains long-term employees and at the same time has hygienists that want to work for him or her because they're such a wonderful person. So bear that in mind as you analyze an office, because nowadays too many people make their evaluation from an office based on paperwork, accounting, profit and loss, procedure code analysis, tax returns, discretionary expenses, W-2s, and also the procedure code analysis, as I mentioned, by provider or by ADA code. So pay attention to this. This could have value that doesn't have a dollar amount to it, but it'll make your life a lot better. And you live longer, retain patients longer, and make your whole dental experience working in office better. So just remember this. And today it compounds that. So I ask you to pay attention to this, and call me if you want to understand this better. I can explain it, but just give me a ring and I'll let you know just what I'm talking about. So thank you for listening. Stay tuned. I think we are in March, middle of March, and we just sent out our list of new practices for sale. I think there were 10 or 12. We have a bunch more. Now, I'm just in New Jersey today. We gave a seminar, and we had about 38 doctors attend, and I'm very proud of those 38. We had, trying to think now, 3 doctors came up to me after the seminar, and I just went to visit 2 of them today. I think is going to sign on with us. So we're getting new practices all the time. We're excited. They had real estate too, so that would be good. Now, these 2 doctors will probably be on my next list, which will come out in another month. So pay attention or call us and we can talk to you about it. But stay tuned for this. That's coming up soon. Thanks so much for listening. We're having a great time. And great talking to you, everybody. Bye.